My name is Natalie Gregory. I am a OBGYN physician in Mount Pleasant, South Carolina. I'm here with WREN, the Women's Rights and Empowerment Network. I'm a fellow in the American College of Obstetrics and Gynecology and a graduate of the Medical University of South Carolina School of Medicine. I was trained to practice evidence-based medicine, and as a board-certified OBGYN, I've been tested with oral and written exams, reviewed by peers, and expected to maintain my continuing medical education in my field of study. I am to use my training to uphold the Hippocratic Oath and obey the laws of our state and our nation while keeping the best interest of the patient as the priority. I believe the following questions are not political decisions, but rather are private matters between a patient and their physician. Because I've been trained to be prepared for any situation, please consider the following situations and help me to make the most appropriate decisions. We've already talked about ectopic pregnancies today. I'm going to skip over my first point and go to molar pregnancies. A molar pregnancy at 9 weeks with a fetal heartbeat. This is a genetically abnormal pregnancy with the proliferation of placental-type tissue that can be associated with an abnormal fetus, sometimes with a heartbeat. It cannot end with a viable fetus and is genetically abnormal. The standard of care is treatment with a dilation and curettage, and this would be illegal with this fetal heart rate bill. The patient would eventually hemorrhage, require transfusions, lose her uterus, and potential for childbearing, and they could die. This is a condition that is curable, but not without proper treatment. This bill sets the medical field back decades, if not centuries. Do I wait until she hemorrhages, knowing there is no chance of survival for the fetus? Is her life worth less than that of this pregnancy? Does she not get another chance for a healthy child? Whom shall I contact to obtain approval for this patient's survival? What if no one answers the phone or if there is not a contact available? I ask because these things happen in the middle of the night. I went to work not this morning at 7 a.m., but yesterday morning at 7 a.m., and I'm still up fighting for women's rights. The next one is fetal anencephaly and fatal genetic disorders. These can be conditions in which the fetal brain does not form correctly or at all. At times, the brainstem can function and can allow a live birth, but typically death will soon follow after delivery. What do I tell the patients who see the concern on my face when I look at their ultrasound? Do I tell them there are no options except waiting for the baby to be born and to die? What if she requires a cesarean and suffers complications impairing her fertility? What if she suffers a pulmonary embolism during pregnancy, which is a known risk? What if she is nearing the end of her reproductive years and wants to try again for a healthy baby, but her clock is running out? May I offer the standard of care? Is it more humane to end the pregnancy early in the gestation or to experience a neonatal loss? Who gets to make this decision and what are their priorities? Who do I call in the middle of the night? What if she's hemorrhaging and a decision must be made quickly? I take calls of 24 hours and my partners and I always are available 24/7. Will there be someone in the legislature available like I am at any time, day or night? What about Christmas morning?
Doctor, I hate to interrupt you, but time's up.
Thank you for your time.
Testimony. Thank you.
I appreciate it.
May I ask a quick question?
Yes, sir.
I think something needs to be asked here. I hear a lot of, as the testimony's gone on today, about legislation that would harm the medical care to a pregnant woman.
Yes, sir.
And especially if the woman's life is in danger.
Yes, sir.
Could you point me to what legislation that is? Because as far as I'm aware, every pro-life bill carves out the life of the mother as an exception, and some specifically say, most of them specifically say that ectopic pregnancies, miscarriages are not considered abortions. You mentioned the fetal heartbeat bill. The fetal heartbeat bill specifically states that that a medical procedure by any reasonable medical judgment is designed to intended to prevent the death of a pregnant woman or to prevent the serious risk of a substantial and irreversible impairment of a major bodily function of the pregnant woman, that is not applicable, that the provisions of the language don't apply. So I'm curious, what legislation are we referring to when we talk about hurting the ability to remove an ectopic pregnancy or a miscarriage?
I appreciate you bringing that up, and I would like to point out that there have been 4 OBGYN physicians today to speak, and the first 2 that you heard from want you to make all abortions unthinkable and illegal. I want you to know that the consequence to me, and I should not be centering myself in this argument, but the consequence to me, a practicing OBGYN physician who is not an abortion provider, is that if I make the wrong decision, if I have to decide between the standard of care, if I don't perform that, I could get sued. If I do perform the standard of care, which to save the life of the mother, I would terminate a pregnancy, physicians can't always agree on that. And what I risk is 2 years in prison, a felony, a $10,000 fine, and the loss of my entire career. If you think that that's not going to cause me to pause for just a moment before I counsel that woman, you're crazy. My family is important. I've worked hard for my career, and I shouldn't have to give it up to do the right thing to take care of my patients.
So a moment of pause might be needed, but my only question was, is there legislation you can point to that does what you're saying? And I'm hearing that there's not. So I appreciate your answer. Thank you.
I would point out that anytime it causes a doctor to pause before they provide you the care that they know is right, that women's morbidity and mortality is going to increase, and that blood will be on your hands. Thank you.
All right. Thank you for your testimony.